Today I am discussing the LE cell, which is also known as Lupus Erythematosus Cell, a rare entity which is shown here in this image. Now, the LE cell is a neutrophil or macrophage that phagocytoses the denatured nuclear materials. Here the denatured word is important. Then they are characteristic for the Lupus Erythematosus, but not specific, as they also found in some other infective tissue disorders. Here, the LE cell phenomenon is seen, in which due to the presence of antinuclear antibody, the nucleus is pushed eccentrically. Now, the LE cell shows the concentric band, like eccentrically placed nucleus, which is not specific for SLE, as I have discussed. Now, two methods for demonstrating the LE cell and the antinuclear antibody are the rotary bead method and the fluorescent antibody method. The rotary bead method is positive in 75 to 80% erythematosus, while the fluorescent antibody method is positive in 95 to 100% cases. In rotary bead method, the principle is the leukocytes are broken down in vitro, allowing the abnormal plasma proteins to react with altered nuclear material. Incubation period enhances the nuclear deterioration and phagocytosis. Slides are prepared and examined for particular Lupus Erythematosus cell. Now, the collection of samples. The collection of samples can be done in the hyperionized bone marrow, hyperionized venous blood, oxalated venous blood, defibrillated venous blood, clotted venous sample, LE factor, and donor cells. LE factor is an antibody found in serum found in SLE patients. Now, the LE cell positive reactions can be seen in rheumatoid arthritis, chronic hepatitis, scleroderma, dermatomyositis, polyarthritis nodosa, acquired hemolytic anemia, Hodgkin's disease. These are some other conditions where we can see the LE cell. It may also be positive in persons taking drugs like phenylbutazone and hydralazine. Now, the interpretation. The LE cell test is considered positive when approximately 2 to 3% of cells seen on the slide in the neutrophil count are LE cells. 2 to 3% are LE cells. Here is considered positive when 10 or more characteristic LE cells are seen during the 15-minute search. Now, the presence of LE cell indicates the lupus. So, the LE cell testing in Buffy code was previously used to diagnose SLE, but now it has been replaced by ANA, which is also known as antinuclear antibody testing. Compared to ANA testing, LE cell testing was less sensitive for diagnosing SLE, and it is labor intensive. Now, we have to know the difference of LE cell from the start cell. Yes, start cell is a monocyte or histocyte which engulfs viable nuclear material. Here the viable word is important. We have already seen in LE cell there is degenerated nuclear material. In diagnostic value and importance, it should not be mistaken for LE cell. Like the LE cell, the start cell also has a phagocytosed nuclear material inside its cytoplasm, but the nuclear material retains its chromatin structure. So, it's viable nuclear material. In start cell, wherever in nuclear material in LE cell has homogeneous appearance or degenerated nuclear material. Here is the figure showing the start cell and the LE cell. Here is the viable material and this is the homogeneous denatured material. These are my references.